Well, as we wrap up the month of May, we want to keep the conversation going around mental health. The more we're talking about it, the more people will feel comfortable to seek help, because there are still many false beliefs about mental illness that are causing significant problems. So Dr. Holly Agud, a psychiatrist with Baptist Health, is here to explain more. Thank you so much for joining us today.
Thanks for having me.
Of course, there are still so many misconceptions around mental illness. A big one is that mental health problems aren't that common. Right?
Right. That is certainly a misconception. In reality, about 1 in 5 United States adults will experience mental illness every year. So in Arkansas, that equates to about over 500,000 people, making it more common than diabetes.
1 in 5.
That's right.
Oh my goodness. Some may feel that mental illness or having signs of mental illness is a sign of weakness. Therefore, I don't need help. What do you think about that?
So just like any major illness, mental illness is not the fault of whoever has it. We know that biological factors, environmental factors play a role, and we can see signs of these illnesses on brain scans and in lab reports. So essentially, it's not your fault. There's changes in the body. You wouldn't tell somebody who had high blood pressure to just get over it.
Yes.
It can't be overcome by willpower alone.
Talk about some of those symptoms that we may experience or a loved one may experience if they have mental illness.
Sure. So there are a lot of different mental illnesses, so there's a whole range of symptoms that you might experience, but some things to be on the lookout for are going 2 weeks or more feeling sad or depressed or irritable, not sleeping well, just not enjoying things the way you normally would, escalating substance use. If you start hearing things or seeing things that other people can't see or hear, or if you're having thoughts about hurting yourself or other people.
Explain how therapy can help.
Sure. So you can think of therapy for your brain a lot like how you think of physical therapy for your body. So if you're having pain or dysfunction in your body, you go see a physical therapist and they help guide you to retrain your body to work better. And really, psychotherapists will do the exact same thing for your brain.
Is it possible for someone to reduce risk factors for mental illness?
Oh, absolutely. So the same things that we do to keep our body healthy can keep your brain healthy as well. After all, your brain is an organ, just like your heart or your lungs. So that means eating well, making sure you get enough sleep, staying active, practicing mindfulness, fostering healthy relationships. And people might not like me for saying this, but staying off your phone. So more and more research has come out that shows that more screen time, and especially time on social media, is having a profound negative impact on our mental health.
Oh yeah, I totally understand that the comparison of your life to somebody else's life. I mean, it's just not a good thing for sure, and so I'm sure it impacts that. Okay, for those who may be seeking help, it may still be hard though to find a counselor or a physician.
Yes, unfortunately, we just do not have the number of mental health providers or psychiatrists in the state that we need. In fact, we have about 1/3 of what we need for the mental health needs of Arkansas. So wait times are on the order of months rather than days or weeks.
How is Baptist Health trying to address the lack of access?
Baptist is actively addressing this problem. So the first thing is we just started a brand new psychiatry residency program. So we are training more psychiatrists in the state. And statistics show that people stay and practice where they trained. So not only are we bringing more psychiatrists in, but we're giving spaces for these people to practice. So we actually just opened up a brand new outpatient psychiatry clinic at Baptist North Little Rock. And we are currently building an inpatient unit that we hope to open in about 6 months.
What do you love about your job there at Baptist?
One of the things I love is just how much Baptist really does care about people. When we ask the administration, we say, hey, we need this, they absolutely respond and give us what we need, because at the end of the day, we want to take care of the people of Arkansas.
What would be your final takeaway from this topic? If somebody remembers nothing else from this conversation, what's that one thing you do want them to remember?
First and foremost, if you're struggling, absolutely reach out, ask for help, don't delay. There's no more shame in asking for help for your mental health than there is in a patient with diabetes asking for insulin. And because of the wait times, don't delay, don't wait until you're in a crisis. We'll get you in as soon as we can, but in the meantime, if you are in a crisis and you need help immediately, you can always dial 988, which is the National Mental Health Crisis and Suicide Prevention Hotline.
Okay, and then of course, I guess the best way to visit Baptist is through a website or a phone number to contact?
Yes, absolutely.
Perfect. Anything else that we should know about mental health awareness?
No, I think we covered everything. Thank you so much for having me.
Perfect. Thank you. I know that we're wrapping up Mental Health Awareness Month, which is, of course, May, but this is so important to keep talking about this year-round.
Absolutely.
So thank you again for joining us today.